Tick tock goes your watch, but have you ever heard the silent rhythm of your own blood pressure? It's the unseen force coursing through your veins, keeping you alive, yet when it gets out of whack, it can become a ticking time bomb. Lewis Drug clinical pharmacist Jonathan Feist is joining us today to talk about high blood pressure, a silent threat hiding in plain sight. So, Jonathan, let's start about talking about what not knowing our numbers can mean in terms of the threat to our overall health.
Yeah, so it's always important to make sure that you're checking your blood pressure at home, especially once we start to get over like 140 over 90, then we are really at risk for like heart attack and stroke. And so by always having a lower blood pressure can help keep that blood pumping nicely through your body and keeping you safe from having
Okay,
events.
so let's talk about maybe the ranges of blood pressure. So like looking at it by the numbers, help us understand what we're looking at.
So like ideally, like 120 over 80 is always a good one there. Once you get to about 140 or like over like 159, then we start having like high blood pressure, and then there's super high, which is 160 or higher, and then we have hypertensive crisis, which is 180, and that's where you'd want to seek medical attention if you're constantly running in that range.
Can you explain the different terms we're seeing, the systolic versus?
Yeah, so systolic is what kind of is like the force that's pumped out from the heart, that's to the rest of the body, and then the diastolic, which is your bottom number, is going to be like the force that's kind of just within the heart itself. And so
can those do those go out of whack together, like correlation, or it can be different?
No, a lot of times it can be one or the other. So that like sometimes it's just the top numbers out of whack, or sometimes it's your bottom one where you're running like 120 over 100, and so your bottom number is a lot higher, and so it's not always hand in hand. But
that can give you information about what you should be doing to address it, right?
Definitely. And so like if you're starting to have like chronic headaches, or seek medical attention, because sometimes it could be related to your blood pressure, or there could be other causes. And so just once you start getting over like that like at least 140 over 80, because 80 is our ideal goal for that bottom number, like they're going to be on high blood pressure medication more than likely.
And I know we're going to talk about taking our blood pressure at home too. I would imagine that for a lot of people, taking it at the doctor's office isn't quite enough.
Yeah, and so especially if you have high blood pressure, like and you're on blood pressure medication, it's always good to check your blood pressure and check it multiple times a day or different times a day. So don't just do it every time, like every day in the morning. Try to do different times and write those down, because especially when you go to the clinic, or even to your, like if you're talking to your pharmacist, they have an idea of like what your blood pressure is different times throughout the day.
I would imagine also sometimes people may get a little bit of a higher blood pressure read at a doctor's office because it's stressful.
Yes, white coat hypertension. I'm a culprit of that too. And so it's always just stressful. And so, and providers are always, and doctors are aware of that. Just try to stay calm, sit with your back straight against the chair, uncross legs, because those will affect your blood pressure as well. And so try to stay as calm as you can. And so then and sometimes that's why blood pressures are better at home than they are at the clinic.
I mean, that's a good thing to know, though. I mean, if it's a false negative or a false thing that you're looking at, you want to know that too. So monitoring at home. So let's talk about the different blood pressure monitors, and the tips that you have. What's the most efficient? And
so there's two different ones here. A lot of times there'll be a wrist one, or there's a normal like cuff one. And I would recommend doing the cuff one instead of the wrist. The wrist can really sometimes not be as accurate depiction of what is like an accurate blood pressure for you. Make sure that you always sit down though 5 minutes prior, and just before you actually take it, don't go walk around your house and then start taking it, because your blood pressure is going to be more than likely elevated with that. And another good resource is Validate, like bp.org. With that's by the American Medical Association, so that has all the different kinds of blood pressure monitors out there, that and shows which ones have been validated and which ones are accurate and good ones for you.
Yeah, so don't drink a cup of coffee, get into a fight with your sister on the phone, run around the house, and then sit down with your legs crossed and try it. Okay, you got to kind of remember all of those sayings. But do you see with people that you work with in the pharmacy that when they start monitoring their blood pressure on their own frequently, that they are able to take more control over how they feel in their own medical?
Yeah, I feel like when patients are just invested in their own health and their own care, and realizing what their blood pressure is constantly, they're doing more things outside of not just sitting around. They're walking, or they're parking farther away in the parking lot. They're eating healthier, especially with the new year. Everyone's goal is to be healthier. And so just the more you see the numbers, it can help you on your journey.
So you should be testing your blood pressure outside of the doctor's office, but if you don't want to buy one of these, I know that some stores, and you can go into a Lewis too.
Like our pharmacists are able to check your blood pressure, and a lot of times we'll give them like a little pamphlet, just that way they can write it down at home too. Especially with every Tuesday, with our senior days, we always have someone there to check blood pressure. I know a lot of patients really enjoy that in the community.
Is it always fine for you to come in and get your blood pressure? Can I come up to a Lewis pharmacist anytime I want?
If you want to ask and say, hey, I'm having issues with checking my blood pressure. I did the machine that you guys have out front, but I just don't think it's as accurate. Our pharmacists are more than capable to check it here at our stores. If
somebody is using an at-home monitor and they just want to come in and use it in front of you and have you verify with your own blood pressure to make sure,
that's a good thing too. Or even just bring your blood pressure cuff to the physician's office, because that's another good way too to validate that. So that's why I always try to tell patients, if you have a home blood pressure cuff, make sure you bring it to your doctor's office too. If you're really worried about how accurate it is, that'd be a great opportunity to make sure. And after so many years, it just doesn't become as effective, or maybe you don't have the right blood pressure or the right size of the cuff.
Now, a lot of people who are monitoring their blood pressure are also taking blood pressure medication. What is it? I mean, what happens if you don't take that medication?
Yeah, so if you don't take it, your blood pressure is going to go up, and you could have consequences there. So it's always important to take your medications every day, and at the same time each day, try to, we are human, so we will miss a day or two, but try to be consistent as best you can, and make sure that you're honest with your physicians to say, I'm maybe not taking my med as prescribed, because the doctor, if you say, yep, I'm taking it, and you're not, and they increase the dose, then we could have side effects of having too low blood pressure or too high of a dose.
Now, too low blood pressure is also an issue, and some people naturally can get pretty low blood pressure.
Yeah, they can, and so that'd be a lot of times your dizziness or fatigue, and so really just make sure staying hydrated will really help with that. And there are some meds that can be used to help raise blood pressure too, but that's usually not as common as high blood pressure.
Right, it's not as common, but you can probably, if you're starting to feel maybe like you're weak or faint or dizzy, that might be something that you look at, particularly if you have access to a pharmacist who can say hey, can you just check this out? I haven't been feeling a little dizzy and I'm wondering if it's my blood pressure.
Yep, exactly. And one thing too, to we always like to tell patients as pharmacists, is make sure you're getting up slowly off the bed or off the chair. Put your feet down. Don't just pop right up out of bed or off the chair. Get up slowly, because if you get up too quickly, that's going to drop your blood pressure too fast.
Well, thanks for joining us today.
Yeah, thanks for having me.
Lewis has been a trusted neighborhood pharmacy and market leader for over 80 years. From expert advice and quick refills to longer hours and more convenient locations, you can find the neighborhood pharmacy nearest you online at lewisdrug.com. This Keloland Living segment has been sponsored by Lewis Drug. Since 1942, shoppers have trusted family-owned Lewis as their neighborhood store and pharmacy. Lewis, your first stop.